Welcome back. We're joined again with Navigator Dan Tzros from U.S. Marketplace. Thanks for being here with us.
Thanks for having me, Doc.
Well, listen, a lot of information for our listeners. So there are navigators there to follow up as we ended the last segment that people can gain access to, even though federal money will no longer be supporting their function.
No, it will be supporting their function, just not any state agency that receives state funding can receive federal funding.
Okay, so now our listeners are even more confused, but hopefully that straightened that out. Are the navigators finding that we need more of them, or do we have ample supply of navigators to handle the workload?
I think what you're finding is a stronger communication bridge being built between navigators and your traditional agent broker community. And I think HHS is seeing the need for agents and brokers to have a greater part in bringing product to market.
Well, let's talk about what Georgians can expect. And as we go into this new enrollment period, I understand that there are more insurance companies that are going to be involved.
Yes, there are. And it's very interesting to watch this because during open enrollment last year, we had 5 companies in Georgia. Only one was statewide, which was Blue Cross. And in fairness to the others, it was Humana, Kaiser, Alliant, and Peach Care, or Peach State. We have 4 new companies that have filed rates with the Department of Insurance, and those are Coventry, United Healthcare, Time, and Cigna. We had 68 plans last year for navigators to navigate through to help a consumer choose a plan that met their needs, and they had to do that in a fair, impartial manner. My concern, what's going to be interesting, is now you have 9 companies. Don't know how many plans, but it's going to be very, very much a challenge for a navigator to sit down that does not have an insurance background and help someone through the labyrinth of information that they have to learn.
Well, let's talk about these different plans, because the public knowledge is that basically there are 4 or 5 levels of metal plans, right? For example, bronze, a bronze plan, which I presume is the most popular plan.
Well, if you want to look by price alone, bronze would be probably the most popular, and it's based on actuarial value of 60%.
But isn't it popular because most people are signing up for the bronze plan?
Well, it's probably most popular because it's the least expensive on a monthly premium, but it's probably the most expensive at point of service when you go to the doctor.
And are you hearing any feedback from people who've used their bronze plan?
No. The feedback I've heard is the people going to the silver plan that are under the 250% federal poverty level that receive the cost-sharing reduction, those are the happiest people out there.
And what are their benefits, or what are they having to pay? Or they still have the deductible of $6,350?
Well, that's the maximum cap for an individual, yes. And with a silver cost-sharing reduction plan, if you're under 250% federal poverty level, you're going to receive the subsidy based on your income. But then when you go to the doctor, there's going to be cost share for the expenses at the point of service for your services.
Can you break that down and make it a little more simple? You go in to see the doctor, are you going to have to pay a copay or pay up out of pocket to $6,350?
Yes, you still have a copay and you still have a deductible. However, depending on the service, the cost share will reduce that amount you pay from what the plan says it's going to cover. So
you're getting cost reduction at the site of service and
Correct.
assistantship in paying for
the premium. If you're under 250% FPL,
and is that the majority of the people?
What we're finding is you had some very good plans and rates coming out from Humana, and a lot of people from the navigators that I've worked with throughout the state, if Humana was available, that seemed to be the plan of choice.
Right. Once again, we're talking to Navigator Dan Tzros from U.S. Marketplace. Well, let's talk about the Affordable Care Act. And you've been an insurance broker yourself, and you're a navigator now. You're helping a lot of people get on this plan, and you're a big proponent of the Affordable Care Act. So, do you really think it's all about health care?
I think it has many facets to it. I think, one, it's creating transparency. There was an article yesterday.
Really? I totally disagree. I mean, transparency in all of this?
Yes.
I've yet to see it. Tell me.
As medical cost. There was a study done where the cost of an MRI was shown, and I believe it was LA, Chicago, they did a study where people were shown the cost of an MRI from several different providers. And those people that were able to choose the least expensive for the same service, they saw a reduction in cost. And it forced the other competitors to lower their price by at least 10%. So
But is that true in all marketplaces? Like
Well,
here in Atlanta,
this
can
is
people
just starting.
find out this information?
Aetna, I think, was probably the leader in showing transparency information. But as far as the other carriers, I think
That's an oxymoron.
they're slow on the uptake.
Yeah. Well, and I love this. Now, this part I do love because, again, that's what this show is about healthcare consumerism. It's your health, your money, and your choice. And you need to be more attuned to your own healthcare needs and what it costs. But I don't think Obamacare is the reason for it.
Oh, yes. I think it has awakened the American public to the true cost
yes,
of health care.
You know why? Because right now they're scared. Everybody's scared. It is a scary time. And I just, it is so confusing. That's why I'm glad that we have resources like you to come in here and talk to us about this because, I just think that that transparency in this system is not there. And I predict, as I'm hearing now from some patients about how they're worse off now than they were prior to the implementation because of their out-of-pocket expenses.
Without specific scenarios, which we can't get into, I can't really address that. But I think the media has assisted with the politics on the fear factor of the American people.
Well, let's,
and
God, we
the
can
Affordable
get into
Care
politics,
Act.
but it's not this. We're not talking about. We're talking reality of patients that I see in our office that come in and tell us about their experiences in primary care locations, and to the point that we, as the low-cost provider, are not on any of these plans. Shockingly, all right, and so they're coming to pay out of pocket through our transparent pricing. And there's a lot more to be told. And I love the good stories, but listen, I want it all out on the table, transparently, what's going to happen here. Because as a patient advocate, I love you being able to keep your kids on your insurance till you're 26. I love no pre-existing condition. I think that's great. I think it's great to have everybody insured the best we can. But I am not very happy with transparency, period, about this healthcare plan because, ultimately, I don't think that it is about healthcare. I think it is much bigger than that. It's about a change in society. And though your focus and mine as patient advocates is to help navigate this for them, I'm really concerned about what it really is doing and if it is going to help people ultimately.
I think we all agree that the balance that has been struck to bring health insurance to the marketplace for all people without pre-existing is probably what people believe to be a step towards socialized medicine. And I don't know that that's incorrect.
I know, and I tell you, based on what's been happening in our VA system, including the one here in Atlanta, I think it's a system that's run amok and headed in the other direction is not the solution either. But fortunately, we have you here to help us navigate this.
Well, I think what we have is a lot more consumers in the marketplace now that's going to help reduce the cost of health care. I think we have greater force on the providers to show what their costs are so we can make informed decisions and select who we're going to receive services from.
Well, I think that's just the American system. It's about kick the tires. Transparency, and it's about competition. It's the American way.
Now, while your services are not in a network, I'm still not understanding why you haven't been able to strike that contract, and you need to pursue that.
Well, we are pursuing it. That's
Good.
just how messed up the system is, that when you're the low-cost provider and it becomes, to your point, very political. But anyway, I'd love to have you back on the show, and we'll talk more about this in the future. So thanks for joining us today.
Thanks for having me, Doc. I do appreciate it.
That's our navigator, Dan Tzros from U.S. Marketplace. Thank you for being here. Have a great rest of your Saturday. You're listening to Doc Talk with Dr. Jeffrey Gallops on Talk Radio 640 WGST.